I'm Brooklyn McLeod, and this is my Resilience Project.
And I'm Marjorie. I'm the nurse navigator that's helping Brooklyn with her project. All right, Brooklyn, we're going to start. Why don't you tell me about yourself?
I've been going through cancer for about 1 year. I have lots of help going through cancer. My family pitched in and helped out a lot. I have lots of visitors. I met a lot of people and nurses.
All right, can you maybe talk and tell us about the most difficult challenge you have faced in your life?
The most difficult challenge in my life that I have faced would most definitely be cancer. It was hard, but I made it. I came through.
And look at you today. You look great. Were there any moments during this time when you felt like you weren't going to get through the challenge?
Yes, there was a couple of times I thought I wouldn't make it through cancer. When I first started treatment, it was hard and I thought I wouldn't make it through. When I was doing radiation, I didn't mind it at first, but when I got to about the middle of radiation, my foot started to get a bunch of blisters. I couldn't stand it anymore. That was the definite most time I thought I wouldn't make it through.
Can you tell us about how you dealt with or how you were able to find the strength to continue when maybe you did feel like giving up?
All my family and nurses encouraged me to keep going because I would make it through cancer. They kept positive. They made me stay positive.
And can you tell us about how you're doing today?
I am doing good today. I have been doing really good since I have been done cancer. I still have to go up to the IWK, but just for checkups and for tests to make sure that I have no cancer in my body. This is about my cancer life.
Thank you for sharing your story with us, Brooklyn. Now we have some goodies on the table that you're going to tell everybody about.
This is a saline bag.
And it's used when people are sick or not well. So it's not just for cancer treatment. We use it to make sure that people are getting enough fluid into their bodies to help them feel better.
This is a saline syringe that they used when after I get IV medication.
So we use that to make sure that the medicine is going through the tube and into you because we don't want any left in the tube. So we call it a flush.
These are gloves that the doctors put on when they hang up the cancer treatment so they don't get splashed.
And if you ever have to come to the hospital, you might see us wearing these gloves. So just because we have them on doesn't mean that we're treating anybody for cancer. But when we were looking after Brooklyn, that's why we had them on. But if you come in and not feeling well and you were to need some help, we might have to wear these too. They protect you from our germs and us from your germs.
This is a rubber band that they use when they're taking blood from your arm. They tie it around right here, really tight, and then they take your blood from here.
Very good. She's the expert.
This is a little bag of saline, and sometimes they put chemo in it.
That's right. And sometimes we use it for other medications too. So you're right, it's a little bag of saline and it can have chemo in it, and it can also have other medication in it as well, like IV antibiotics. So you might see these if you're visiting somebody in the hospital that's not in there for cancer as well. But for Brooklyn, it was used for her chemo and some of the drugs used to manage her side effects.
These are alcohol swabs that they used to clean the tubes, and when they're giving me a needle, they clean my skin first.
Very good.
This is also a mask that they put on, that the doctors put on so they don't get any chemo or any medicine in their mouth.
And it will protect you from any germs that we might have. So if we had a cough or a cold, we would wear a mask to protect you from those germs.
These are some blood vials that they use when they're taking blood from your arm. They put it in these vials and then send it off to the blood lab.
Perfect. It's exactly what I was going to add. That after that, it goes to the lab, but you already knew.
These are little syringes that if you have an IV in already, that they can just put these into your tube and take blood from it.
Or give you the meds.
Yeah.
And there's no needles attached to these. So sometimes people, as soon as they see them, they think, oh, that's a needle. But these are actually just blunt plastic tips.
This is
What we use with
saline, and this is what they put in needles.
That's right. So we use, if we have medicines or medications that are powdered, we would put them in here and shake it up, and then we would put them in the bag to give you, right? And do you want to talk about this?
These are beads that I got when I was going through cancer, and for the different things that I went through, I got a bead every time I did something.
So what would you get a bead for? Can you tell them that?
I got little black ones for having a finger poke. This one is for hair loss. I have a lot of these little bumblebee ones because I used to have to get a needle in my arm every night. The boats and little trains are for traveling from home to the IWK.
What about, do you have one for your fort? What's the fish for?
This rainbow one is for child life. Whenever I met a child life at the hospital, I'd get one of these.
And so a child life person is somebody who works with the families and the children when they're at the hospital to help them take their mind off of why they're there. So they have things like iPads and cool crafts and activities to keep kids busy and active and to help take your mind off your treatment, right?
Yeah.
Yeah. And these are called, you call them your beads, but what's the whole name?
They're called bravery beads.
And you can all imagine why that's why they're called that, right? Do you have anything else you'd like to tell them?
No.
Thank you.
Thanks.